the impact of the pandemic on small and intermediate towns and to the responses that are being formulated. We had over 200 participants, so the bar rises every time. In the last session, and we had a case study from Mozambique. We had a number of international organizations, OECD, ILO, UCLG, as well as a mayor from the Netherlands. So it's getting more interesting and more rich as we go along. And we decided that in this session, we're going to focus on the impact of the pandemic on the slum dwellers and the urban poor, again with a very particular lens of urban-rural linkages and integrated territorial approaches. For me, the work that we've done on urban-rural linkages, it started in 2015 and but reached a major milestone in 2019 with the agreement on the guiding principles and the framework for action to advance integrated territorial development. So what we call the urban-rural linkages guiding principles. And these guiding principles basically seek to orientate the actions of different actors to reduce inequality, spatial inequalities, and unequal access to resources and services across the urban-rural continuum. In the context of COVID, for me, 3 elements have stood out, which also shine a light on some of the key issues and principles that we as UN Habitat are focusing on. First, the issue of migration, not only to cities, but also back from cities. Slums and informal settlements are an important reflection of urban-rural linkages in many cities. A majority of slum dwellers are low-income migrants from rural areas in many, many, many cities. They come because of spatial inequality across the rural-urban continuum, and they settle in areas which are an extreme version of spatial inequality. So nothing changes, sometimes becomes worse. But during COVID-19, as many of these low-income migrants working in the informal sector lose their jobs, we're also seeing a pattern of reverse migration back to rural areas in search of food security and possible agricultural income and possible closeness to their communities and a revival of their social capital back in rural areas. So there is a very, very strong link between slums and informality and the urban-rural continuum. The second link we are seeing is food security. We know that supply chains, especially for food, are a key link between urban and rural areas. But the breakdown of these supply chains affects not you or me, who will stock up and who will hoard and who will buy imported canned stuff from supermarkets or cold storage stuff from free stores. But it is the urban poor who don't have money or space to hoard food, who are reliant on the markets and the vendors. They will face the impact most of this breakdown. A third, I think, is a big issue is the portability of social protection. Most migrants would have to spend years and years in a place in order to be registered or to be eligible to access social services such as subsidized healthcare or education or other services. But then they move back to rural areas and these entitlements are not valid anymore. They are not portable between states, between regions. How can we change this? Social protection is not something that you can give up when you need the most. How do we make sure this is portable? So these are, to me, some of the critical issues, and I hope our panelists today will touch upon some of these. Now, this series and this particular webinar, of course, is being held in collaboration with the Centre for Sustainable, Healthy and Learning Cities and Neighbourhoods, SHLC. This center is an international consortium of 9 research partners, which is aiming to strengthen capacity to address urban health and education challenges in neighborhoods across fast-growing cities in Africa and Asia. And it's funded via the UKRI, the UK Research and Innovation, as part of the UK government's Global Challenges Research Fund, GCRF. So today we will have some SHLC researchers based at NIUA, the National Institute of Urban Affairs, and World Vision India, and they will share insights about the COVID-19 impact on slum dwellers and urban poor. We also have a number of other speakers, and I'm going to introduce them in a second. First of all, we'll have Joseph Muturi, who's the co-chair of Slum Dwellers International. We'll be talking about Nairobi. Then we'll have David Everatt from the School of Governance, University of Witwatersrand, Johannesburg, who's a co-investigator of SHLC. Then we have Debolina Kundu from National Institute of Urban Affairs, an old friend of mine, also a co-investigator of SHLC from India, and my colleague and friend Kerstin Sommer, program manager of the Participatory Slum Upgrading Program. The idea is for us to do a little bit of a deep dive into some case studies and then zoom out again, going from Africa to Asia, and then a world view that Kerstin will offer at the end. So that's the plan. We will have some discussants straight after, who will open the discussion, and then we'll have some time for questions and answers. So I'm going to now open the floor to the speakers. Joseph Muturi, I'd like you to go first, talk about Nairobi, talk about Kenya. You will have 10 minutes each. Each speaker will have 10 minutes. I will give you a warning after 9 minutes. I will give you a stronger warning after 10 minutes. And if you extend beyond that, I will have no choice but to mute your microphone and move on. So please, we have a tight program, and we would be grateful if you could stick to your allocated time. Joseph, the floor is yours.
Thank you very much, Shipra. I hope everyone can hear me.
Yes.
First of all, on behalf of SDI, we'd like to appreciate for giving the opportunity for us to be here. I had requested that Gail can help put my presentation on the screen. I don't know if people can see it. Oh, thank you. There it is. Thank you very much. So I'm just going to give a brief context of what here slum dwellers have been doing in support of, we mainly work with the biggest slum dwellers movement in Kenya called Muungano na Vijiji, and supported by the local NGO, SDI Kenya. Please move to the next slide. So those are basically the numbers. Given the organizers have been very generous with the time, I'll just skip through. But basically, to give you a rough estimate, Nairobi, we are talking about a population of over 4 million people. We are talking about a quarter of them living in informal settlements. Next slide, please. So we are looking at basically a typical characteristic of a slum. Most of the people migrated from the rural areas. Most of them are economic migrants, came to the city to look for work. Most of them have relatives in the city center. And as I mentioned before, 6% of the population live in informal settlements. So most of them live in 10, very, very, very congested. And most of them, it's an average household has 4 persons per house. And the densities are up to 220,000 per acre. That is the latest data that we have. Next slide, please. So continue the estimation, I shared that. So one of the things, some of the challenges is that what our research is telling us is that with an estimation of 200 households sharing one tap, that we have seen that in Mukuru, we have seen that in Huruma, we have seen that in Kibera. And most of them, if you go to Mukuru, 20 households usually share one toilet. Next slide, please. So we looked at our first, why we intervened, and we were the first people to hit on the ground. We looked at what are the challenges in the informal settlements, what are the gaps, and most of you who are aware that most governments are approaching and addressing the issue of COVID on a health perspective. They are not looking at other perspective. So we look at what are the challenges that may lead to direct interventions. The government is doing targeting mass testing. It has imposed travel restrictions. There's a lockdown in Nairobi. People can't travel to their country. And we are looking at people who have lost their livelihoods. They have lost their jobs. Most of them wanted to go back to their rural areas. They couldn't because Nairobi is under lockdown. The other issue of given the densities, it's a challenge in terms of people keeping social distances and issues of wearing of masks. And Nairobi was also imposed on a curfew of 7 p.m. to 5 a.m. in the morning. There was closure of schools. There was a quarantine of suspected cases, and some of the challenges which are coming out of although the government is trying to address, was people were supposed to pay for the time they have spent in quarantine. And that, I think, stopped a lot of people from going to testing. People are afraid, if I'm found positive, I'll be slapped with a bill of 42,000 up to 50,000 shillings. So there also the issue of identifying. So our approach, what we did, number one, was to get community organizations and grassroots organizations working in those areas. The other thing was people were a little bit skeptical in informal settlements. They were a little bit of suspicious. There were a lot of rumors. No, the government is blowing this thing out of proportion because they want to tap into resources that are being given by the World Bank. So we started the messaging, we put posters, we translated posters, we made sure that we have supplied posters just for people to understand, we have the community health workers going around just talking to people about the COVID. So we created a mechanism of awareness raising. People are discussing in WhatsApp groups, in small community volunteer workers going around the communities. So the other thing was to look at what are the specific things that the slum dwellers require. Number one, I said, there was no provision of, as much as the state was telling us and the Ministry of Health was telling us to wash our hands, there was no provision of washing station, there was no provision of soap, there was no provision of mask. So that's one of the things that we made sure that we supply with other partners in these informal settlements. The other challenge was that even with the provision of washing stations, soap and mask, some of the challenges in Mathare, in Kibera, in Mukuru, there was lack of access to clean water. So the other thing we also leveraged on was to get ourselves into the task force which were formed by the government. We are part of the task force that is sitting with the Nairobi Metropolitan Services. I mentioned, so the other thing was also to look at the immediate need was the provision of food aid, because a lot of people, mostly informal settlements, live from hand to mouth. Most of them are casual laborers. Most of them work unskilled jobs in the industrial area. They work as domestic servants, and most of them, their livelihoods were cut short. We go to the next slide, please. So, as you know, what we have been doing as Slum Dwellers Federation, our role basically is to organize communities around access to basic services, access to land, secure tenure, and access to decent housing. So we have a number of specific programs targeting youth, women. We work with other organizations in terms of training, volunteer community health workers. So we tapped into that network of also the human rights defenders. We also are working with the social justice centers. So our role was also to activate our membership on the ground to be more active. Continue, please. So the other thing, how we leverage on our information. One thing that that got us into these committees, that we had up-to-date, accurate information on the informal settlements. We have done profiles of all the informal settlements in Kenya. We have up-to-date data. So we leverage on that. So at the moment, what we are working on, we are collecting information in 120 settlements in 4 counties in Kenya, and those are the ones which are hard hit by the virus. We also do a daily monitoring. We have people working, the volunteer community health workers working in informal settlements, just talking to people, assessing and monitoring, and we're also sharing this information with the ministry. So at the moment, we have conducted almost 15,000. By last week, we had conducted 15,000 interviews. Continue, please, the next slide. So our contributions to these subcommittees was number one, to share the informal settlement profiling data, computation of required washing facilities per settlement. The other thing, just to digress a little bit, we realize that even the people who are providing the washing stations, they are providing them at the roads, at the main roads, at shopping centers, but nobody was going deep down. So we kind of share the information to look at where this information, where this assistance is urgently required. So we have organizations that like Plan International that came in, that used our maps to identify those areas. So I talked about the weekly monitoring, evaluation, just to see in terms of tracking who has symptoms, who is sick. Please, and also we provided maps of these areas just to help the agencies and the authorities to move around. Next slide, please. So what are the impacts? Number one, I mentioned loss of livelihoods. Majority depend on daily incomes from small businesses and employment, which were greatly affected. And the other thing I also mentioned, they couldn't go back to their rural areas. So one of the challenges was the difficulty in obeying the government directives, the curfews. So you'll find that most of the people who live in the informal settlements, the toilets are usually outside their households. So imposing, and some of them are at quite a distance. So it was a challenge for people to keep curfew. So the social distancing, the congestion, most of you have seen how slums are packed. And also the lack of basic needs. So there was an increased demand for water resources and food across the slum population. So those are the
Joseph, you have 1 minute.
Okay, let me move. Next slide, please. So next one, I think as we had mentioned, these slides will be available for everybody to access. So we are looking at some of the lessons, and some what we are also trying to push for is the government to come out very strongly and support communities and support organizations and institutions which are working in the informal settlements. And the other thing we also noticed that even the data, as by yesterday in Madare, we realized even the data that is being given out by the government, sometimes it's inaccurate. So we had cases of, like in Madare, they mentioned they had around, I can't remember, 40 cases. But what we realized, most of these people were not actually from Madare. I think the government opened some businesses. They said restaurants and hotels will be opening from morning up to evening. And I think for the health workers, for you to open, your health workers had to go to a certain place to get tested, and you had to pay a fee. So most of them are taking advantage of going to these free areas, the areas which are doing free testing. So we are also pushing for the government.
I have to ask you to wrap up, Joseph. Thank you.
Okay, thank you very much. I think, thank you.
Oh, you were almost there, so not bad. Thank you so much.
Not bad. I tried as much as I can.
Thank you. We are a bit short on time, so I'm grateful for your sticking to time, and I'm sure you'll have an opportunity to respond if particular questions are posed to your presentation. Particularly, I think people might want to know a little bit more about the urban-rural linkage dimension of the challenge in Nairobi, which we know, those of us who live in Nairobi, is very, very pronounced. But let's see if that comes up. Thank you so much again. I'd like to now move on to David Everatt, who's one of the co-investigators of SHLC from Johannesburg. David, the floor is yours, and you have 10 minutes.
12, please.
10, please.
Okay,
you can get a minute to respond if there are questions at the end. Thanks.
Okay, can everyone see that?
Yes, we can see that.
Okay, cool. So my name is David Everatt. I work at the School of Governance, and I'm a country PI for SHLC. I'm trying to answer the questions that you sent us to try and shape the discussion. And so one of them was about the extent to which slums and the urban poor cover, what portion of the urban form do they cover? And there's a map of Gauteng province, which is where I'm talking to you from. So you can see the urban form going both north-south and west-east. The yellow is what we call informal settlements, which probably come closest to what you call slums. And the red is townships. And the reason I say this, whoops, sorry, I didn't want to do that. The reason I say this is not that we have any ideological opposition to the notion of slums. It's just that apartheid urban design was so powerful and has proved to be so enduring that we're still stuck in the language of townships, what they used to call squatter camps, what we now call informal settlements, and so on. But you can see there that the yellow is growing, and the yellow is informal. And whether you're up north in Tshwane, in the center of Johannesburg, these are where the cursor is, those are the old, supposedly white suburbs zoned for white people under apartheid, southwestern townships, and this is the mining belt. So you can see all the townships that were built there. It is worth noting that we're at 66% urbanization as a country already. So that this discussion, sorry, trying to move these things, has to take place in that context. The young man on the right is from our node. I also run a health demographic surveillance site in the province, and the young chap there is from our node in Malusi, which is an informal settlement. But you'll notice that at least one wall is a brick wall. The other one is a cardboard partition between different rooms. And so informal takes many, it covers many different typologies. And I think the important thing to note is that, as with many post-colonial cities, the city center and the suburbs around it were zoned for whites. And anyone of color was pushed further away and had to migrate into the city to sell their labor. And I think what we're finding now is that, as obviously democracy has been here for 26 years, the informal route into the city is the only affordable route for the poor to get anywhere near jobs, job opportunities, education, health, whatever it happens to be. And so, although we have designated townships and informal settlements and so on, in the city center, where the apartments used to be for a single white family, they're now subdivided and rack rented. So you'll have multiple households in a single dwelling. When we go to the southern suburbs, which used to be lower middle class white zoned areas, each garden now has shacks in the garden. The garage is rented out. You may have a caravan that you rent out. So the poor are not sitting neatly in particular places waiting for us, I think, is the simple point. The real concern I have is the narratives that are already attaching to this disease and what it's going to do for the notion of urban-rural. So this is a South African infection map about 10 days ago. The pattern has stayed the same. The numbers have simply increased. And you can see here that Cape Town and the Western Cape, in other words, the winelands behind it, tourist heaven, is now extraordinarily the largest hotspot in South Africa. You come up here to Ekurhuleni. That's where OR Tambo Airport is. That's where the tourists fly out of. Here's Durban and the Alembe district down here. Those are all big metropolitan urban centers. These two hotspots here are in the Eastern Cape. And what you're finding is we had a 4-day, unlike Joseph, we had a 4-day warning of the lockdown to allow people to go. And so urban workers who had migrated rural to urban to sell their labor have migrated home, but have seeded the disease. And so because it's a communal, this is Africa, we do things communally, not kind of individually. So a funeral, for example, is not a private family affair. It's for the whole village and the surrounding villages. And so funerals are becoming a flashpoint for community infection and hotspots. And that's what these two large hotspots are. So they're workers who went from Cape Town back to the Eastern Cape and have begun to seed the infections there. And those are beginning to spread in rural areas more and more. That sets up a worrying notion that the dirty subject is the urban subject, and when he or she returns, they bring disease with them. And you're trying to talk about more harmonious planning and integration, it's going to be a challenge. The two images are a 30,000 sample survey that I ran a few years ago in Johannesburg. And basically from that 30,000, we said, where were you born? So the top map just shows you how few people are actually born here and migrate, whether it's urban to urban, or, rural to urban, or what we actually often find is rural to peri-urban, where you kind of gather your goods, your social capital and your actual capital, and then you springboard into the city. But you can see Johannesburg in particular is a city of migrants internationally as well. So you can see whether it's from the subcontinent, all over Africa, and one lone Kiwi who sailed via Antarctica by the looks of it to come to Johannesburg, presumably to learn how to play rugby. And so it's when we think about urban-rural linkages, I think we have, certainly in our case, we have to think beyond Johannesburg, beyond South Africa. It really is a much broader issue than worrying about the borders and the boundaries that we created for ourselves. Very briefly on what's happening, we have a very hard lockdown. On Monday, it's meant to go to stage 3, which is meant to be slightly easier, which I think for middle-class people means we can get hot food at restaurants. But there's an army-enforced curfew, there's a police-enforced curfew, and what we're seeing is that we are pushing health crises into the future. So we have the highest HIV infection rate in the world, and people have gone home and they are simply not coming to the clinics to get their medicine. We have amongst the highest TB and drug-resistant TB epidemics in the world, and those people are simply not coming. We've got, as you can see there from our Hillbrow node, 10 to 15% of the normal figure are actually coming to clinics. So clinics are becoming, and that includes the mobile clinics at the bottom. Clinics are now being seen as where you go to get infected. In other words, I go to the clinic and I'm diagnosed as having COVID. I don't want to go there because I don't think I had it. I was asymptomatic. Now you're telling me I'm ill. It's because I came to you. And I do think the health-seeking behavior of everyone, but particularly of poor urban people and rural people, is going to change quite fundamentally as health services become places of suspicion rather than necessarily places of healing. On this one, the only block that really matters is that last one on the right. 29 women and children arrested in Cato Manor, that's a township outside Durban, for sleeping on the street. They were sleeping on the street because they were evicted, and they were evicted because she couldn't keep her job, the women couldn't keep their jobs because of the lockdown. And so rather than helping, the police response is put them in prison. We don't necessarily, and you can get a criminal record for this as well. So it's quite serious. I'm not sure we've necessarily done some of the creative stuff that Joseph was talking about, which is make them pay for the privilege of being in prison. But I'm not going to give our government any ideas like that because they may take us up on them. But I think his point is absolutely true. This is a week ago in Johannesburg. This is the queue for food parcels. Okay, so you can have a mask or not, but if you're poor and hungry, you cannot afford to social distance and be very polite and nice. You have to queue like this because other people will take your place. The mayor, who's a student in our school for what it's worth, says there are 300,000 households in Johannesburg that are going food hungry. 300 households means, well, it's over 1 million people, individuals, are going hungry in Johannesburg. We also have a ban on the sale of alcohol and tobacco. And we have a whole bunch of, we won't argue about the goods or the bads of it, but what it means is that if you're poor and addicted, you are now spending even more of your limited disposable income, if any, to buy from the illegal trade. Here is a 3-kilometer queue of people queuing for food parcels outside Pretoria. Pretoria is our administrative capital. So this could be Delhi and it could be London and it could be anywhere. This is our capital and this is people queuing just to eat. And one of your questions was, are people getting differential treatment? And what I think we found is that down here, which is a photograph I stole from a news site, you can see that's the chap, he was actually in that queue in Hillbrow for food a couple of slides back. So that's what the inner city, if you're not adopted by a program, by an NGO, by one of our kinds of projects, that's how he lives. And he's starving. And he was in that queue for food. And you can see the conditions. On the right, this is an informal settlement. This
One minute.
Okay, I'll speed up. This should be the poorest of the poor. But you can see our health worker there with his gloves, everyone with masks, a little bit too close. But other than that, really, you wouldn't have much to complain about on that one. This is just to remind us of the enormous burden, gender-based violence, psychosocial issues, mental health issues that are going to come and bite us as we go into the future. My last two slides, Chairperson, very briefly. I think that the narratives that are coming out of this are beginning to become extremely xenophobic. That's police in masks helping Somalians empty their their shop, forgive me, before it's burnt down by locals, and you can see someone's already spread "get out" on the wall. So xenophobia, which is South African, but also a race discourse in which it's a white disease. We were told that melanin will protect people from COVID and so on. The danger of those narratives, I think, is very, very strong. So in conclusion, and forgive me for taking so long, I think that the rural-urban linkages are going to take strain because these narratives need to be managed. I think we're thinking of this only as a health crisis. It's not. It's a kind of social contract crisis where the ties that bind us are going to be stretched to the limit. And I think if we're going to realize the new urban agenda, then we need to talk much less about smart cities and making it easy for business to do their business, and talk much more about how we deal with this inequality, xenophobia, gender-based violence that is being thrown into stark relief by COVID, but which was there before. My final point is COVID has wrecked the economy already. We're normally told no bold decisions because you'll destroy economic performance. Given that the economy is gone, this may be a chance for our leaders to actually take some bold decisions. Thank you.
Wow, thank you. Many, many takeaways from that. Two big ones that stay with me also because we've heard them echoing in many other parts. The urban person bringing the disease home. We saw many scenes in India, migrants returning home, blocked from their villages, locked out, sprayed with insecticide and germicide. That narrative was very much played out in many parts of the world, I think. And the second bit about this being a crisis, and not just a health crisis, but a social contract crisis, I think very important. And the need to reinforce, reaffirm, and drive home the point again that this is about justice, this is about inequality, injustice, this is about inequality, this is about lack of respect for human rights, and those are the underlying challenges, and those are the underlying issues to be addressed. So thank you very much. I think that was great, David, very much appreciated. We'll move on. I've already made a couple of references to India, so I'll hand the floor to Debolina Kundu, who I'm sure is going to talk about the Indian context. Debolina, the floor is yours. Welcome. You have 10 minutes.
Thank you, Shipra. I hope I'm audible.
Yes.
Okay. This is, I'll be presenting the impact of COVID-19 on the lives and livelihoods of the slum dwellers. This is I'll be presenting the rapid study of slum dwellers in 10 Indian cities and a few peri-urban and rural locations. And the evidence that emerges out of this analysis is basically a disruption in the urban-rural linkages. We had a vast team. This is a collaboration of World Vision India and the SHLC team at NIUA. As we know that cities are hotspots of COVID-19 and slums are the basic areas where because of inequality, the things are really worse. And India has more than 17% of the country's population living in slums. And with the lockdown measures, we are in the 4th stage of our lockdown. Measures have been taken to contain the virus, but supply chains have been broken, which again broke the urban-rural linkages. A section of the vulnerable people started moving back to the villages. And based on all these facts, we thought that it's important to understand the impact of COVID-19 on the poor and vulnerable. We are trying to build an evidence in phases. This is the results I'm going to present is the results of the first phase of the survey. When we look at the basic amenities in India as a whole, we find that slums are not in a very favorable position when we look at various basic amenities, and rural areas are much more distressed. And the latest data from the NSSO also supports this. The slums in India are not served with basic amenities to an extent where when we compare with the non-slum areas, things are much worse in the non-notified slums, whether we look at drinking water, bathrooms, use of latrines, or availability of soap and detergent in the washing places. The major themes which I tried to address is livelihood, food security, knowledge on COVID, women and domestic violence, access to basic amenities, which again influences social distancing, and education and health. The selection of cities was basically where World Vision has their interventions. This was done through telephone survey, so which is a major limitation. We spoke to the slum dwellers for 15 to 20 minutes. The telephone survey happened in the last week of April and the first week of May. And we took the consent, written consent, telephonic consent from them. There was also focus group discussion, and the sample was around 100 households from each of the 10 cities, and all 1157 households were interviewed, which was around roughly 6,000 people in all. The locations are shown on this map. I'm not reading through the name of the cities, it's all evident here. When we look at household characteristics, all major religious and social groups were represented. We had 32% notified slums and 16% non-notified. We had urban villages, 20% peri-urban villages, and others. We had 32% migrant households, and we also tried to classify the poor, updating the poverty line. We had 42%, 42.8, roughly 43% people below poverty line. If we take the 2011-12, the latest poverty line, and update it with the February 2020 data, we found a new emerging new poor or the moderately poor in urban slums, and also 30% people above poverty line. And when we look at the extent of poverty, it was basically the casual laborers who are extremely hard hit. We had a question on what is the principal source of income. So the casual laborers who were, as I mentioned, with the class reporting the highest number of respondents. People were basically working in the service sector, followed by construction, transport, trade and hotel, and slightly on manufacturing, which was 12.3%. We also had self-employed regular wage earners and a small percentage of others. This you can see from Chennai, this is the vertical slum. The auto rickshaws are all standing because of the lockdown. When we asked that whether the principal source of income has been affected across households, the answer was yes. Around, I think everyone was hard hit, the self-employed and the casual laborers the maximum. And also, what was the nature of the impact was another question which was asked. So loss of jobs was the maximum, and many of them did not receive their last month's salary, and reduction of wage was also another. So the most hard hit was the casual laborers who lost their jobs, followed by self-employed. They are not very big entrepreneurs. They were all petty entrepreneurs selling stuff in their push carts. And because of the lockdown, because of the disruption of the chain of urban-rural linkage, I think they were most hard hit. And this is the scenario all across the cities. I'm not going into the details in the interest of time. The coping strategy which was resorted to by most of the households was taking money from their own savings and money lending from their relatives. And this is this you find all across the cities and as well as the peri-urban areas. Social distancing, the government is trying to really ensure social distancing, but as David mentioned, that is not possible. We find higher congestion in the bigger cities, lower congestion in the small towns and in the peri-urban areas, where the social distancing is being adhered to. People generally go to fetch water from the public stand post, and that is seen, the maximum percentage is seen in Kolkata, Hyderabad and in Kanchipuram. When we looked at the access to bathrooms, again, exclusive use of bathrooms was 66%, but this is because the figure from Mumbai showed 100% of the people had makeshift arrangements within their tenements. So that increased the figures. If we delete Mumbai, I think the figure comes down sharply. Same with regard to latrine facilities. Most of the households do not have exclusive access to latrine facilities. And as I mentioned in the beginning, a large section of the people went back to their villages. And these are basically the migrants who, the sedentary migrants who did not go back to their villages. We tried to work out the figures for various communities where we find they are not as well off as the sedentary population. And there are various estimations on the vulnerable migrants and the circular migrants, what is their share. The latest figure from 2011-12 is around 200 million, of which 65.7% constitute the rural-urban stream. And as I mentioned that 40 million to 140 million are the conjectures, the various estimations of people going back to their
1 minute, Debolina.
Rural areas because of this lockdown. Support systems have come in from the government, but that is not enough. What you'll have the presentation with you. We can discuss later if someone is interested. I'll just go through those policy implications directly. We find a new class, the new poor emerging very rapidly. Concerns of this vulnerable class needs to be addressed. And also there's need for real-time tracking of health and livelihood conditions of the people. There should be focus on health, housing and basic amenities of the slum dwellers so that social distancing is possible. I don't think that will be possible in the very near future. Poverty and job loss needs to be tackled immediately, and both lives and livelihoods are important. And this binary which we have between rural and urban, I think that needs to get to be diffused, and there should be efforts for integrated development with effective urban-rural linkages. Cities need to be more inclusive and mainstream the migrants, so if such a pandemic happens again, people do not go back to their villages in dire distress. Intermediate towns need to be promoted to develop seamless continuum of rural-urban linkages, and governance mechanism needs to be strengthened. Capacities across the government layers need to be developed, and data systems need to be improved to facilitate data-driven and evidence-based governance. I think I gave you too much of the stuff in the last 10 minutes. If there are any questions, I'll be happy to address. Thank you so much, Shipra.
Thanks, Debolina. Yes, you gave us a lot of food for thought, a lot of data, a lot of rich analysis. Thank you very much. A couple of things. I think you're absolutely right about this binary, and that's the focus of UN Habitat's work, the importance of diffusing this binary and looking much more at integrated territorial development, integrated territorial policy. The other thing that's interesting from your last slide is also the idea of intermediate towns and cities. So basically the development of a system of cities rather than relying on primate cities. So, you know, those that offer maximum opportunities, attract people from really far. And then this whole sort of, you know, the chain, when it's broken, it's dire. So I think that was very important. Also the point about what you were saying, that how are people coping? And the idea about coping strategies using up their savings. I was talking on with a group of SDI leaders from across the world a couple of days ago in a meeting, and they were saying that what they're seeing is also that it's not just savings. People are also, because of the open-endedness of this crisis, they're also using up their capital, and they're also withdrawing out of savings groups. So we're not just looking at poverty now, but we're looking at poverty continuing and perpetuated poverty for the future because of these breakdowns, and because people will take a long time to bounce back. So those are important issues that you've reinforced. Thank you so much again. We now move to the last presenter, my colleague, Kerstin Sommer. Kerstin, of course, is the manager of the Participatory Slum Upgrading Program, one of our largest and most impactful programs in UN Habitat. And she can give us a bit of a zoomed out view, Kerstin, of how you see this crisis unfolding and its link, its relationship with urban-rural linkages. Kerstin, the floor is yours. We can't hear you.
Yes, thank you. Thank you very much, Shipra. I'm starting the presentation is still uploading, but anyway, thank you very much for this opportunity. And I'm speaking both in the function of being part of the task force of UN Habitat related to the COVID-19 with the emergency response, and the Participatory Slum Upgrading Program that we're implementing in partnership with the ACP Secretariat, African, Caribbean, Pacific countries, and financed by the European Commission. So yes, we have heard about already the vulnerabilities, and I'm very pleased to say that UN Habitat played an important role in defining the UN framework for the immediate socioeconomic response to COVID-19. And we have there two pillars that are particularly relevant for the discussion today. One is on the pillar 5 on community resilience and social cohesion. And then there's also the third pillar on basic services and social protection. And very important, this framework also makes reference to the urban-rural linkages, both with the perspective of the risk of spreading the virus, and also the mitigation of the same, and the controlled migration and movement, but also from an action point of view, how one can really link the support networks and frameworks and actions with a community-driven lens to increasing the resilience of communities. I'm not sure if one can actually see my screen.
Yeah, can you go to the presentation mode? Can you click on the presentation mode? Maybe that's part of the challenge on your within PowerPoint.
It seems that it's still loading, it says so. Anyway, let me continue just like that.
Please.
We all know the slums have several vulnerabilities, and already related to the slum deprivations, also where we look at housing, water, sanitation, tenure security, and the overcrowding at household level, but also at neighborhood level. But with the urban-rural linkages and also the COVID-19 challenge, we really see an increased vulnerability, and much has to do with the questions around affordability. And here we see that rural areas become again a pull factor to informal settlements and people that live in poverty, and, as we heard, inequalities, because from health services to food access to also water, sanitation, everything is more affordable in rural areas. And also we know the urban society is cash-based, and as we hear, people are losing income, livelihoods are becoming unstable. So with that, rural areas become attractive. And at the same time, we also learned from Ebola that actually more people were affected by the impacts of measures taken and poverty-related impacts there than actually the disease itself. And we also learned the importance of having a very careful look at connections between rural and urban areas. And we learned the danger of mitigating disease when one doesn't take into consideration the movement of people, the needs of people. So one area is very important to the response planning, that we look at the people's needs and also at those linkages and see how we can support those networks and also assess the feasibility of certain, for example, Shipra already mentioned in the beginning, the most obvious also is the food security, I mean the food supply chain, but also looking at support, socioeconomic safety nets, I mean also financial exchange, support between family members, and one has to also mention, even though it's often very uncomfortable, but also should people pass away, we have cultural considerations that are also very important. And informal settlements are often seen as city, urban, and very central locations, but also when we look at integrating in urban responses, we know that informal settlements are not aligned with the administrative borders of cities. They also sit in peri-urban areas, and they do have, the more we, I mean, already the informal settlements at the center have quite often rural characteristics and cultures. We see farming, we see pigs, we see animals that are very much also there as, let's say, a backup for the livelihoods and the household income. But the more we go outside, the more actually we have still the rural culture. And this one is also a very important one to take into consideration. So in our response planning, we've put a lot of effort in putting guidelines together and implementation tools that really are with an integrative perspective. So both with a territorial, the governance level, but also the sectorial issues, the different themes from water, sanitation, food security, mobility. It's really a very complex issue, and we really advocate for governments to align national responses and national measures in line with those needs at community level. So we want both. I mean, we heard already the criticism of a top-down approach. We believe it's important to have a top-down approach that is informed by the bottom, and that is really people-centered, and at the same time also a planning with the people, so an integrated, inclusive community response plan that is framed by local authorities, response plans, since they are at the forefront coordinating, and really a two-way communication also between people and governments. And we know one approach fits all doesn't work, so that we have also the necessary flexibility and adaptability. We already heard about the inequality, so an equitable approach to really provide the right support to keep up the coping mechanism of communities, including also resources, is very key. And talking about that, we have looked at several case studies, so we really welcome the approach from Costa Rica with the national guidelines that give really orientation for local authorities, but also for community engagement, where we have this territorial approach bringing into the service provision to informal settlements. We also saw a very good approach in Freetown, where we have the local adaptation at city level, where again urban farming and actions that cater for linking urban and rural areas is there. And with the UN Habitat approach, we've learned with our partners in this COVID-19 emergency and provided tools and guidelines in line with that. And one thing also looking forward, it's much actually about when we talk with partners and looking at the long-term recovery to learn from interventions from rural areas now, because we see that poverty is increasing in urban areas due to the COVID-19. So we're talking more about actually the conditions, the back to the community assets of rural areas that we need to leverage in the recovery. So here we are, for example, also in the context of Africa, promoting a challenge fund that has been applied by partners like ACF and also the Kenyan Climate Innovation Center in rural areas, but actually no partner has yet applied this in the urban context. So this becomes a very important also resource to bring private sector, other financing mechanisms into the urban context, and then again bring informal settlements also into the investment perspective for the private sector, since the rural private sector is comfortable already, but hasn't applied the same in the more complex areas. And we feel with the COVID-19 and also the need to organize people, really show the importance of a peoples-based approach, because only with people you can change behavior and actually show an adequate response to this. We can leverage this mobilization to also build partnerships for the long-term recovery. So it's about balancing the needs of the people in the urban settings, ideally keeping them there, but then also providing the perspective, the long-term perspective of change, and leveraging the urban-rural linkages in the best way possible and the way forward. So I thank you very much for this opportunity.
Thank you, Kerstin. That's really very, very important, the last bits that you were saying. One, the long-term perspective, keeping the long-term perspective in mind, and also learning from interventions that have worked in rural areas, and how we've looked at leveraging assets in rural areas, and can we do this similar, can we undertake similar efforts in urban areas. So very, very interesting indeed. And thank you for the great work that you're doing, especially with the COVID response measures. I see there are some questions to you in the chat, and we'll come to those as well after. So thanks again. We'll now go into a bit of a discussion, a triggered discussion. So we have 3 discussants who are with us, who will help us open the discussion today. You will have 2 to 4 minutes. You have a bit of a window. I'll give you a warning at 2.5 minutes, again at 3 minutes, but you will go mute at 4 minutes in the interest of time. Please highlight a couple of points maximum, or pose some direct questions, and try not to repeat anything that's already been said, unless it's so important that you want to see it 5 times in the report, then that's fine. I'd like to start with Kerstin Thomas, who's the regional leader, South Asia Pacific of World Vision International. Kerstin, you have the floor.
Thank you. I have my video on, but because we've just gone through, because the power has just gone out in Bangalore where I am, I think it's probably more effective for me to use my candlelight in a very limited manner. But anyway, I have 3 specific interventions that I would make. One question that often, and this is primarily to Debolina because of the Indian context where I am. One question that often gets asked is, are slum dwellers really poor? Or are they slum dwellers simply because of the lack of affordable housing? And given the fact that you mentioned that you used a random sampling method to select the samples for your survey, in the normal course, I would presume that this method would have led to different categories of slum dwellers being picked up in the entire analysis. But since you started with World Vision and your partner has World Vision, and World Vision generally tends to work with the most vulnerable slum dwellers in a city, at least we like to think so, would it mean that the results would have a certain degree of bias, and it might look blacker than it really is? So that's the first question. The second is really when one looks at the way the elite have behaved, and it's come up in a few presentations as well, almost treating those who are infected, and particularly the poor, as if it was their fault for bringing in the infection. It might be useful to look at this question, how many really wanted to leave, and did all want to leave? And how many are better off for having stayed? And and to look at kind of having left, having stayed, did it really make so much of a difference in their condition, in the level of poverty itself that they experienced, the level of exclusion that they also experienced during this length of the crisis. The third point that I wanted to make is that many of the findings correlate fairly well to some of the other studies that have been done. For instance, Azim Premji University survey, which talked about 8 out of 10 workers in India having lost their jobs. In urban India, losing their jobs, 70% of rural and 80% of urban households not having enough money to buy a week's worth of essentials. A lot of people, 34% in rural, 43% in the urban, taking a loan to cover needs apart from using up their savings and liquidating assets. Also correlates to another study that World Vision itself has done in 118 of our locations covering 5,600 households, where only 4% reported a small impact on their livelihoods. 96% reported a very moderate to severe impact on livelihoods. So going forward, where does it leave the whole demographic of our country? For instance, we know that there are about 400.
Arun, you have 30 seconds.
Yeah, 350 to 400 million people below poverty line, about 600 million on that $2 to $10 spending per day. So what would happen in your opinion to the poor? Of course, the poor would stay poorer. Those at the cusp may get pushed back. Those above the margins may get pushed back into poverty for a few years. Are these likely scenarios that would emerge? What are your thoughts on this? Thank you.
Wow, thank you. I don't know if any of those or many of those questions can be answered at the current stage of the research, but we'll let Debolina look at some of those. I think the point certainly being that what has been the impact of this movement back and forth? Who stayed, who went, what was the impact? And what are the coping strategies of those who went versus those who stayed, etc. So thanks very much. Next, I'd like to invite Richard McCarthy from Slow Food International. Richard, I believe you're joining us from Brooklyn. Welcome, and you have a few minutes also, 3 minutes about, to make your comments.
Thank you so much. Can you hear me clearly?
Yes.
I'm thrilled to be here. It is true, I work with Slow Food International, and in particular on a Market Cities initiative with other NGOs like HealthBridge and the Project for Public Spaces. And specifically, I'm working with the FAO Dhaka Food Project. And as I think that what I've heard throughout this marvelous morning is that crises peel away the veneer that otherwise is hidden, hiding the ongoing, inequities and policy decisions, for which is often already a frayed social contract, as was described in South Africa. In places like Bangladesh, where the weak social safety nets are there, where there are weak social safety nets, the informal economy becomes and is the social safety net. And what the lockdown brings to the equation is, well, what happens when this is also brought to a standstill? We find public markets to be useful vantage points with which to observe the situation. And in Dhaka, we're publishing a weekly situation report on the food markets and the prices, and really examining the prices that are changing, fluctuating, rather rapidly in times of crisis. And I provided a link in the chat to see what these situation reports are. There's one on the markets and one on the urban poor. But in particular, looking at the strategy of the markets, we begin to understand why are some products fluctuating dramatically. For instance, chicken, which is an important access to protein for the slum dwellers. Well, demand collapsed and then supply collapsed. And then with Ramadan and the hotels, chicken is a very popular dish that's served, and suddenly the demand increases again, and it puts a huge pressure on the price. And of course, when the prices go up, as they have since the lockdown, 20%, sometimes 60, 100% on some products, well, this means that those who are particularly vulnerable will eat less. Examining which ones have hiked up and which ones have not, I think does give some insight, in particular for the urban-rural linkages, on which have shorter supply chains. And we have seen that, for instance, lentils have remained more stable, whereas onions, which are imported, have fluctuated greatly. So I think it provides a helpful insight to look at where to invest in building much stronger urban-rural linkages for products. We also see where opportunists squeeze farmers and vendors at the wholesale markets. And there has been some of a clampdown on this, but I think there needs to be more. The wet markets have responded by disallowing street vendors and cook foods into the markets. They're trying to figure out how to manage these very intimate spaces where there's close human proximity by doing some creative things. Fewer vendors, as well as breaking out into the outside where streets are now empty, so they're filling them with markets, so very creative response, as well as into open fields. There is also interest, and this is both top down and bottom up, to establish many more safety markets out in open settings. And how to do this, as we've seen throughout the region, with creative social spacing and otherwise something that is very difficult to maintain. We've seen,
Richard, have a minute.
Perfect. We've seen some terrible missteps with providing food, some of the subsidized staples with the open market sales. But we have seen some great innovation. The army stepping in Chittagong and Yashore to come to the farmers' rescue and to be the middleman with transport, purchase, and then donating the food to the rural poor. I think I'll stop there.
Okay, thank you very much. Some very, very important questions there on how the markets are functioning and how they can be made to function in response to the crisis and to the pandemic. How perceptions are changing, but also how circumstances have changed. And how all of this comes together. Okay, very good. Thank you so much. Last but not the least, I'd like to call upon Samuel Ikua from the Mazingira Institute. Samuel, you also have a few minutes, 2 to 3 minutes to make your comments. And then we'll have maybe, I can pose some of the questions that are being put up in the chat, and then we get responses from the panelists. Samuel.
Yes, thank you, Shipra. My name is Samuel. I work with Mazingira Institute. I would like to take these few minutes to respond to and add to the presentation by Joseph Muturi. Mazingira conducted a study on food security in GCRF slums, and we use urban agriculture.
Samuel, we have a challenge. We have a challenge with your connection. Yeah. We can't hear you very well. Either you'll have to turn off the video. We can't hear you very well. Sorry.
Okay. Yeah, maybe that is better now.
Try.
Yes.
Try. It's still very broken. Try.
Okay.
Yeah.
So we have an urban agriculture as a food security intervention in the slums, where we found out that our chicken producers, they are making very low sales or none at all because people no longer have the purchasing power. The vegetable kiosks are closed because people are no longer buying. And those few people practicing urban agriculture, they are all harvesting their produce so that they can share with their neighbors. And this is taking a toll on their produce. We have some urban farmers saying that some of their chicken have been stolen because people are really poor. They have no cash to buy food anymore. And sometimes they are forced to sell their products at half price. So this is an urban farmer keeping chicken in such a small space in Kibra. Now with all these effects, they say they have employed some coping mechanisms. We have the chicken sellers, they don't have cash, but they have the chicken. They take their chicken to the shop and they exchange it with food products from the shop. That's one of the coping mechanisms. For those keeping chicken, they don't have cash to buy the normal feeds. So they look for kitchen waste to feed their chicken. And due to the overharvesting of crops, the ones producing vegetables, they are doing what we call planting. They plant vegetables in different stages. We have mature ones, the ones and the others are coming up. This image shows you on the left, they just planted those ones. These ones are near mature, and now these ones are full, they're harvesting these ones. So by the time these ones are done, they can't harvest these other ones. So these are some of the coping strategies through urban agriculture. Due to the cut of urban-rural linkages between the 3 urban areas and the upcountry, there are no more food coming in, so they have to use urban agriculture as a means of coping food insecurity in the slums. So that is it for my submission.
Thank you, Samuel. We had a bit of a bad connection, but clearly your slides were helpful. The idea about urban agriculture and looking at food as a means of food security for the urban poor, particularly those in peri-urban areas who have a little bit more space, but also others, and how that can replace some of the more some of the livelihoods and livelihood scenarios that are breaking down. So thanks very much. We do have a number of questions in the chat. This is a very lively discussion. I'm going to take up a few to start with. I think there's a whole cluster of questions around local governance and institutions and the role of institutions. Both to David, it seemed that a lot of the responses are community-led, community-based. Where are the local governments in this? Where is the relationship between policy responses of national government and local government? There's also some questions for Kerstin on local government capacity and finances. So there's a whole bunch of questions around that, which I would like you to maybe the panelists first to address, and then we'll take any more. I think the second set of questions relates to this portability of social protection and services. There's a number of questions around alternatives to decentralized clinics, health systems. How can we cope with those? And there's a third set of questions around data. How are we looking at data? How are we collecting the right data, and how are we using it to target the interventions properly? As we know, not all slum dwellers are poor, and not all poor are in slums. And some of them have gone back, and some of them are the new poor, and there are people slipping into poverty every day. So this is a very fluid situation. How are we looking at collecting the right data for us to tailor our responses and target our interventions properly? So I would take those three to begin with, those three sets of questions: one on governance, one on data, and one on social protection and the availability of portability of social services. And I'll give each panelist maybe a couple of minutes to respond to those before I take any more. Thanks. Perhaps David first, and then Debolina, Kerstin, and Joe. 1.5 to 2 minutes, please.
Okay. My opening joke takes about 10 minutes, so I'll never make it. I think
too bad. Not here.
But part of the problem, I think, with asking where are the local institutions, where is government, is that as we've been locked down for 63 days now, and within those 63 days, government's messaging has become deeply confused, so that all sorts of very arcane regulations have been developed. You can't buy open-toed sandals, but you can buy boots because it's winter. You can't buy this and you can buy that. But if you try and go out shopping, you're liable to be arrested because you're out and you're supposed to be locked down at home. And I think the loss of faith in government as an entity that can actually help me in the most basic senses rather than harm me, I think that's really what's at play here. Because whether it's national, provincial, or local, which is our structure, they are all sending very different messages. Party politics has begun to enter into it, so that the lockdown itself is now being challenged in court. And what's happened to the opposition is we now have a profoundly libertarian opposition that just says open the economy immediately. They could all be sitting in Trump's cabinet quite happily, and it's all about the economy. And in that debate, the poor disappear. because it's just about the economy. The economy must work, and if the economy works, somehow trickle down will once again not happen, but we can all pretend it will. So I think and that's not helped by, I know Joseph didn't talk about it much today, but I heard him previously, you know, the violence with which the police and the army have really clamped down on the poor has deepened that. I know it's happening in the slums in outside Nairobi. It's certainly happening here. Our security forces killed someone 2 weeks ago in Alexandra Township, which is just over the road from Sandton, you know, the richest piece of real estate in Africa. So it really is, I think, pushing people's tolerance. We've been through 10 years of state capture, massive corruption. We're meant to be on the way out of that with Cyril Ramaphosa and this new government. And this thing hits, and even at the level of food distribution, which we're doing through ward councillors, they're beginning to say, well, did you vote for me? And if you didn't, you're not going to get the food parcel. And so I think in that's why I'm saying the social contract is fraying, because if I can't even trust my local councillor, who I may live next door to, how on earth am I going to trust those people up there who are setting the army on me? And I think in those ways, the status of government as having legitimacy is increasingly in question. One last sentence, sorry, on the issue of data. I do think the problem, I sit on Stats Council, which advises Statistics South Africa. We're tending more and more towards collecting big data sets, but planning at a very, very local level. And the notion of doing integrated urban-rural planning is not on the table at all. It's, you know, how much more local and responsive can I be? And I think the agenda needs to switch much more in your direction.
Wow, thank you. Yes, very important and very revealing, you know, the use of, we are collecting a lot of data, but what are we using it for? And are we using it for the right things? And are we going in, which direction are we going into? So thanks very much. And the loss of faith in government, very important and very visible in many parts of the world. Okay, Debolina.
Yeah, I think we are also sailing in the same boat as Professor David mentioned. Governance is totally fractured in the country. The different departments, be it railways, who has to manage the migrants, the PDS department, the local governments, state governments, central governments, they are just not prepared to face this crisis situation. So what direction we are moving. That's one thing. And again, with data is being collected, but how are we going to use that? That's a big challenge. And the government did announce one nation, one card. So portability of entitlement will be issued, will be addressed. But then again, one needs to see what actually happens. And I would also take this opportunity to answer at least one question which was put up by the discussant. So yeah, we did target the slum dwellers who are being held by the World Vision in Indian cities. But the reason why we took the cities were the metro cities, and the cities, the non-metros were the cities where there was a large incidence of COVID cases, and the poorer section of the population were addressed, and we did find the non-poor also living, but then a large section of the poor did, because of the fluid situation, did go into poverty. So we find a new class of emerging new poor, and I do not know how their issues will be addressed, because data issue is a big challenge in the country. So how, and many of them do not have bank accounts. So how will they be benefited from direct cash transfer? That also remains to be addressed. Thank you.
Thanks, Debolina. And I want to pose the question of direct cash transfers in a second as a follow-up, because that's a big one. Kerstin, particularly on data, I think, and there was a question in the chat also saying, the innovative data collection stuff that you and Habitat is talking about, what does this mean? How is it innovative? How is it going to be useful? Perhaps you want to start there and then go to one of the other questions, either around governance or around portability.
Yeah, thank you very much. yeah, data is obviously it's a very key element here, both for the direct response to the disease and also to the response to the living conditions and the impact of the COVID-19, the socioeconomic impact. So yeah, data collection, again, we're having different scales of data collection that we're looking at, but particularly for the informal settlements and slums, we're going again with the community-led approach, where we're looking at bringing technology and people, data, local knowledge together. So we're working obviously with different mapping tools and also actually volunteers, quite exciting, from different universities around the world to help us really to map quickly. But UN Habitat has developed this hotspot mapping, so we're really focusing on, let's say, on the priority data collection points because of the scale. We heard Nairobi 60%, so the majority of the people live in informal conditions. So we're starting to prioritize in hotspots, which are fortunately easy to identify in the COVID-19 context because of the spatial characteristics. We're talking about densities, we're talking about availability of services. So if we have high density settings, then we can already assume that there is a vulnerability, high vulnerability, both economically and health-wise. So we're looking at that, but then also bringing this together, the data collection, and particularly on the spatial inequality with the investment opportunities and the financing, because I think that was the second question, how local authorities can be supported there. And we all know there's a total overwhelm on this. So it's looking at what kind of investments are needed in those hotspot areas, and then also bringing in new partnerships, particularly also private sector on this, with obviously also responsibly, we know this comes with risk, but together with governments and people to bring together those immediate investments, but also the long-term transformation perspective. And again, also looking at the different financing entry points there, where local authorities become a very important partner, but also people are there and thinking also of a different way of how to do, from the data collection that was people-based to also the implementation of the actions where we promote a labor-intensive approach, where we combine technology and smart solutions with people's capacity and assets on the ground. Thank you.
Thanks, Kerstin. Thank you. No, very important, all of those. The combination of efforts and identifying the most catalytic interventions, catalytic and transformative, if that is possible. So I think that's quite challenging. Joe, I'll come to you, particularly around questions of how do you understand the impact of the pandemic on food security of slum and informal settlement dwellers. So another data-related, certainly a data-related question, but also how the federations are working with local government. Those two, I think, are particularly important that I'd like you to address in 2 minutes.
So, I think I'll start with how we are working with local government, but also, you are aware, most of you who live in Nairobi, you are aware we don't really know who is in charge of Nairobi. We have the Nairobi Metropolitan Services. And I think from what you have seen so far, their priority is not COVID. Their priority is to do other things. They are clearing roads. They are doing evictions in the middle of this pandemic. And I think there's no clear support that is coming, as much as they have tried in Mathare and Mukuru to dig boreholes. One of the things that we also shared our data and our maps, it has just been talk. We have not seen much action on the ground. And also at the national level, you are seeing that food trucks being launched with color and pomp and all this drama. But if you go down, the food is not actually reaching to the intended beneficiaries. The other thing you mentioned about some of the data, just to mention the data that we have, as you know, we have a database of almost all the slums in Nairobi. One of the things we are partnering with a number of organizations. One of them is an organization called Give Direct, which we have given them around 50,000 names that they'll be doing a cash transfer every month for the next. So there are a lot of people who are willing to help, but they don't have the information. We're also working with the KCB Foundation that is also going to provide cash support, cash transfers to the most vulnerable in the community. So the other thing in terms of also, I think we are beyond in terms of food security. So people are saying, I think you mentioned earlier how federations, they are now using their savings. And I think for us, the question has gone even beyond using their savings. We are now looking at even one of the questionnaires. What have you sold in your house? What household item have you sold in order to survive? So those are these the new things that which are coming up, and the information that you are collecting now. In terms of looking forward, we are looking after this probably if at the end, I think the challenges are going to be much higher than what we are experiencing now in terms of people going back to work, people going back to their livelihoods. As you know, the Federation work with mainly support small loans with the level. So we are looking forward how many people are actually going to need, and we are trying to put together a facility that can be able to give small loans to people just to bring back their lives to a level of normalcy.
Thanks, Joseph. That's very, very, very encouraging, and a good note to really conclude on the community solidarity, the importance of using the social capital and leveraging social capital. Very important. Okay, I think we're pretty much at the end of this. I don't even know where to start to summarize such a rich discussion. I have, as I said, I've spotted 3 or 4 or 5 really, really critical points. The points around data, the points around the importance of using technology, using traditional sources of collection of data, whether it is surveys or whether it is household surveys or government information, but also then combining it with community level validation, hotspot validation, so that you can target your interventions. I think that's a general point that's very important, particularly for slums and informal settlements. Zooming out a little bit on how do you make that happen when people are moving back and forth between urban and rural areas? Very important. Again, the use of technology possibilities are enormous, but tracking systems come with their challenges. When you already have governments going more authoritarian, do we want to give them more rights to track us and keep tabs on us? But are those tracking systems going to be the lifesaver for the people who are on the move? That's another point that I was thinking. We didn't go into it, but I think that's quite important to think about. The third, in terms of messaging, rural areas, urban areas, national governments, NGOs, local governments, everybody is giving different messages. Somebody says the disease is international to urban, to rural. Rural dwellers say, well, we don't want you. Urban dwellers say, well, we didn't ask for it. So it's not a disease of the poor. Is it a disease of the rich and the middle classes? The sort of stigmatization, the sort of messaging, particularly also having its impact on the urban and rural dimensions, is very important and must be considered in all our work. Third, I think the fact that very often the responses and the support is not reaching the intended beneficiaries, either because we don't know who they are, or because it doesn't filter down the system, or because they have moved and they are elsewhere. I think those are also important questions that we are grappling with. More questions than answers, actually. And finally, the question that was not addressed yet, but the one around direct cash transfers and how possible that is. Perhaps not yet there in India, and we're talking about the challenges of the banking system. But in many other parts, in Kenya particularly, where we live and where many of you are from in this meeting, the whole M-Pesa system is the way to go in terms of direct cash transfers, is the possibility. So I think those are all opportunities and innovations that we should look at, and we should exchange, and we should tap in order for us to reach those who need us the most in these trying times. So thank you again. Thank you for the very rich discussion. It's been a very intense session. And do join us for the next one in the series. I'll give the floor to Camilo to tell you about the next webinar And have a good evening, have a good day wherever you are in the world.
Thank you very much, Shipra. We had today a very interesting discussion, like also very important points. I would like also to thank you for joining us today. To our speakers, Joseph, David, Debolina, Kerstin, and the discussants that we had today as well, Sharon, Richard, and Samuel. So just to conclude, I would like to invite you to our next session that will take place next Thursday, that is June the 4th. And in this next session, we are going to touch on the topic of neighborhood governance and community response, also closely related with the topic of this webinar, analyzing this also in the context of urban-rural linkages. So yeah, thank you for joining, and hope to see you all again next Thursday. Bye-bye. Have a good evening, afternoon, and morning.